the hospitals are incredibly strained, and let's be honest. We are in a dire situation now, and mainly it's really due to lack of staffing. And just like in our school systems, healthcare workers get exposed, healthcare workers get sick. They have to quarantine and isolate. That leaves less healthcare workers to take care of patients who are in the hospital. So, and before the Omicron surge came, hospital staffing was already a concern because so many healthcare workers have also left. So they're extremely concerned. They're strained. They really want people to make the right decision to protect themselves, so they don't need to be hospitalized. And we're just hoping that we can get through these next couple of weeks so that our hospital can really remain viable. But everyone should be concerned about our healthcare system right now, and they need all the help that we can give them. Now we know that acuity of illness might not be as severe, duration might not be as long in the hospital, and we probably don't have as high number of people on vents. But the bottom line is that the hospitals are being overwhelmed because of the sheer number of infections, and we've got to prevent exposure. We've got to prevent infection, not only keep people safe, but also to maintain viability of our healthcare systems. And viruses, what they do is that they evolve to maintain viability, and this virus has done an outstanding job of evolving and changing so that they can continue infecting people and remain viable. And as you recall, early in the pandemic, children weren't really being infected with COVID-19, but now the virus has changed. Omicron is much more infectious for children than COVID-19 ever was. And that's what viruses do. They change, they take whatever opportunity they can to remain viable and keep infecting so that they can continue to be a living thing. So that's not going to change. So what we can change is our response to it, and follow those preventative approaches to stay safe and not be exposed, so that this virus does eventually not have people to tag team on and infect, and so we can see this pandemic eventually start to wane as well.